Thank you, Mark, for that really interesting talk. And we have a lot of questions in. We won't be able to answer them all, but we hopefully get through most of them. So John Morgan's asking about supplements. Are they beneficial in prevention and recovery of knee injury?
Yeah, okay. So supplements is obviously a fairly big topic. The common ones that people talk about are going to be things like glucosamine, chondroitin, the fish oils, and then there's things like turmeric, which is a sort of a popular one that people are purchasing and trying at the moment. Now, from a purely scientific standpoint, the evidence for these supplements is pretty weak. People are welcome if they like to try them, and some patients seem to report they get some benefit, but scientifically there's no good evidence to show that it slows up the process of wear and tear, arrests the process of arthritis, or really gives much symptom relief over placebo.
Okay.
So I always tend to say it's up to the individual. They can try it, and by all means they may get lucky and find it helps them, but I don't tend to routinely say you must be on this supplement or that supplement. And that's the problem with, as we say about arthritis generally, is we don't have great medical treatments as of yet.
Yeah, okay, yeah. Donald says, how do you know the difference between normal aches and pains after, say, a long run, if the aches and pains are normal, and the warning signs of an impending injury?
Yeah, so again, it's, you know, a lot of people might get a few aches and pains. That isn't necessarily a problem. It's the degree of pain and the restrictions it causes maybe afterwards. The warning signs, you say in the knee, is the knee that reacts badly to that activity that evening and the next day. So people may feel that the knee swells within a few hours. Maybe go to bed that evening and waking up with pain, and then coming down the stairs sideways the next morning and limping a little bit, and then it eases off, and then 2 days later maybe they feel they could run again. That's probably not that's a bit of a vicious circle that you're getting into. So you need, that's what I mean sometimes about listening to the knee symptoms. That's your knee telling you that there's a problem. I think those are the times when I'd encourage people to get looked at and maybe get some imaging, particularly if there's a lot of swelling, just to make sure that you're not running into troubles with significant chondral damage and arthritic issues. But if it's a little ache that doesn't seem to hold you back too much, doesn't seem to have like a hangover effect, you're not having to take loads of painkillers and anti-inflammatories, a lot of those can probably be ignored. But it's obviously it's going to be different from person to person.
So a question here from Jennifer. Damaged patella tendon 3 months post-pregnancy, not new to running, had no knee issues before, slowly built up running again to 20 minutes wearing a knee trap. How likely are these types of injuries in returning again, and any tips on how to avoid them happening?
Okay, well, this sounds like, you know, reading the question is a bit difficult when it's specific to an individual, but it sounds like somebody who's returning to running after they've, you know, sort of post-pregnancy. Now, one of the issues with pregnancy is obviously, you know, there is quite a lot of weight gain, puts a lot of stress on the joints, and there is also a lot of hormonal changes. Some of the hormonal changes can lead on to ligamentous laxity and joint pain in itself. And because sometimes a lot of core weakening may happen, so, you know, with the pregnancy and the stretching of the abdominal muscles and the stress on the back, there is often a bit of it takes quite a long time to restore strength in and around the core and the glutes. So it's not uncommon then if someone, even if they've been a runner in the past, can return to activity and they're running into a bit of that overload and overuse issue, which we talked about in the talk there. I would think that the predominant thing is to ease back, go back to real basic strengthening and conditioning type exercises, work a lot on core, and wearing knee straps. Probably, I don't find that particularly useful. I know a lot of patients seem to like wearing them. I find it very difficult often to really explain to patients what they're doing. So, you know, the tight straps that go underneath on the patella tendon and things, I think you're better off going down a good rehab route as opposed to trying to rely on a strap.
Okay, thank you. Leanne, Mark, my knee hurts when I used to go up and down the stairs, but has eased. Now hurts only when I lunge. It does ease as I stretch my hamstring, my quad. Doesn't hurt when I run. I'm thinking tight bicep femoris or IT band syndrome.
Okay, so this is one of the commonest knee symptoms for everybody, not just runners. So this is patellofemoral pain.
Right.
So front of the knee pain. So it won't be, I think, anything to do with the tight biceps femoris, which for people is one of the hamstring tendons. And I don't think it'll relate usually to the IT band syndrome issues. So it's the loading position of the patellofemoral joint. So it's that going downstairs is sometimes worse than going up. Any single leg squats, split squats, Bulgarian squats, those kind of issues, and a lunge. So my feeling on that brief little history there would be that be much more patellofemoral pain, and that could then be, you know, the crunching and the noises that people get would be very common in those positions as well, usually from the patellofemoral joint. So the rehab would be focused there.
Okay. Brona says she's a keen runner, meniscus resection 10 years ago. Knee pain has resumed in the last 2 years. MRI is showing osteoarthritis, medial compartmental cartilage, meniscal damage. She's been recommended to have a uni knee replacement. Will she be able to resume running after this?
Okay, so this again is some of those challenging conditions that we talked about there. So this is clearly I don't know what age this individual is, but obviously having had a significant meniscal resection in the past has led on to accelerated wear and has now got what seems to be what we call a unicompartmental advanced arthritis. So again, it will depend a little bit on the patient's age, and the unicompartmental knee replacement is a good option for day-to-day life, but not for returning to running, in my opinion. Yeah. So I do partial knee replacements or unicompartment knee replacements often, but these implants are not designed for running. They're designed to give people a better quality of life in their day-to-day routine. People set, you know, activity expectations are going to be for walking, maybe some hiking. If they do well, you're into the next level of activities, which could be your golf, maybe playing some light doubles tennis. And that's as far as I usually recommend people take it. Obviously cycling, gym work, so there's things you can do, but actually going out on the road and running with a knee replacement is not going to be advisable. If you're having a uni knee, you want that to last, and no moving part lasts forever. So if you're in your 50s getting a partial knee replacement, you know, that's a stepping stone to a total knee replacement usually, and you want to look after that knee. So stay active, but don't go into those surgeries with the goal of returning to an impact activity, heavy impact activity like running.
Yeah, thank you. Peter, he's torn his meniscus in both knees in the past 12 months. Can he expect that it's likely to happen again? He's 55.
So again, this is the degenerative meniscus issue. And again, often you do find people who have very similar experiences on both their knees. So somebody who's got meniscal tear on one knee has obviously been followed up by a similar problem on the other side. So those issues at 55 are evidence really of a degenerative type process that's going on. So I wouldn't necessarily be concerned about the meniscal tear in itself happening again. You'd be more worried about the consequences of the damaging meniscus and the damaging joint. So that would mean getting into problems of arthritis. Yeah. So in terms of having the meniscal tear happening again, I wouldn't be too worried. It's more the consequences of having the tear in the first place that I'd be a little bit more concerned about.
Okay. Karen's a 49-year-old runner, currently approximately doing 20 to 25 miles per week, including speed sessions. History of distance running. She's very mild knee pain from time to time, but not problematic on both knees in the last year, making a crunching, grating sound. Should she be concerned?
All right, well, I think it'd be interesting to do sort of a survey on everyone who is in this talk about crunching and grating from the knees. I can tell you my knees crunch and grate all the time. Almost every knee I examine is going to have some clicks and noises. And so crunching and grating in itself can often be very benign and mean absolutely nothing. Or it can sometimes mean there is a bit of wear and tear. And that's going to be, again, around the patellofemoral joint, around the kneecap. So those up and down stairs, clicks and grinds that an awful lot of people experience, generally from the patellofemoral joint. So again, in the gym, the squats, the lunges, the leg presses, the force on the patellofemoral joint, And as I said, it can just be quite benign. And if it's not associated with huge pain and swelling, I wouldn't be too worried.
Okay. Last question from Deirdre. Can chondromalacia be treated with surgery?
Okay, so chondromalacia, all that term means is soft cartilage. And it means chondro, as we talked about, there is the surfaces of the joint, so soft surfaces of the joint. And the common term that you hear is chondromalacia patellae, which is soft cartilage on the kneecap. It's a very umbrella term. It doesn't in itself mean very much. And, you know, chondromalacia patellae is often talked about, and it's not usually very responsive to surgery. So in simple terms, no, chondromalacia does not usually lead to surgery. It's a pathway, it's a process that's going on of the surface of the joint starting to get a little bit damaged. And if it's on the kneecap in particular, most surgeons, most sports surgeons will be nervous to recommend surgery for a bit of damage on the back of the kneecap, because often it doesn't change that much. Yes. Certainly not as much as the rehab probably would.
Okay. Mark, thanks very much for joining us tonight, and